Welcome back to Rapid Review for MRCEM exam. We are going to discuss the next question on the topic of major trauma. I've got Sam with me. So Sam, this is the question. We have got a 65-year-old patient with history of COPD who is brought by the ambulance to the emergency department after a fall from height. He's tachypneic with a respiratory rate of 36 breaths per minute. He has got diminished breath sounds and bruising over the right side of the chest. A chest X-ray shows multiple rib fractures and an underlying pulmonary contusion. His PaO2 on blood gas is 7.3 with normal carbon dioxide level, and saturation is 84% on room air. Now the question is, what is the most important treatment for this patient?
Okay, so with this patient, I'm concerned, obviously he's really struggling from a B point of view, so some respiratory distress and technically a type 1 respiratory failure if he's PO2 of 7, but CO2 is okay. He's COPD, but stats of 84% are lower than we would want. So option A, administer adequate IV fluids. Again, it's not my priority at this point. We'll assess in C, but like we said previously, fluids are not normally a priority in trauma unless they need blood. B, initiate intubation and mechanical ventilation. So this is a possibility. This is a gentleman in type 1 respiratory failure who is having quite a hard time. So this is potentially an option. C, perform intercostal nerve blocks for analgesia. Yes, I do want to do this, but again, this is something that comes down the line. This is not the most important management. We need to get on top of his breathing and his B assessment. D, monitor with pulse oximetry and ABG measurement. Again, very important, but it's not actual treatment. And the fact that he's got in respiratory failure and got stats of 84% needs addressing first, or administer non-invasive ventilation. So my options are basically between B and E. I must admit I'd probably be tempted to go for E normally, but this is a patient who not only has type 1 respiratory failure, but also has an significant underlying respiratory condition in the COPD and might not be able to therefore compensate. So I'm going to say B.
The question was, what is the most important treatment for this patient? Out of all the options, we have got this option B and E. So B is initiate intubation and mechanical ventilation, and E is administer non-invasive ventilation. So in the setting of trauma and with the presentation where he has got multiple rib fractures and underlying pulmonary contusion, option B is the correct one, because option E is not sufficient to help with the ventilation and oxygenation. And option B is the correct approach, and this is according to the ATLS guidelines. So good, well done, Sam, you're correct. Thanks for watching. I will see you in the next video where we are going to discuss another SBA on the theme of trauma. Till then, take care and goodbye.